to urgent care when you think you have something that needs to be addressed that maybe isn't life-threatening. So if you think you're having a stroke or a heart attack, you should go to an emergency department. But for lots of other things, we can deal with them just as well in the urgent care. So things like bumps and bruises, sprains and strains, lacerations, asthma, abdominal pain. We always recommend that if you have a primary care doctor, you should call your primary care doctor because they know you the best. But for those times when your primary care doctor's office is closed or they're not able to see you and you need to be seen, that's what we're here for. So not all urgent cares are the same. We call ours advanced urgent care because unlike a lot of other urgent cares, you're always going to be seen by a board-certified emergency physician, which is not the case in every urgent care. The physicians that work at Chestnut Hill are the same physicians that work in our emergency department here at Beth Israel Deaconess. And most of the time at urgent care, we're taking care of relatively minor complaints that you can get seen and discharged fairly quickly. But if you're sicker than you think, or there's a problem, you want somebody who can recognize the problem. And the board-certified emergency physician, kind of the gold standard for recognizing serious problems. And if a serious problem arises, that's who you want taking care of you. We have full access to CAT scan and ultrasound and x-rays and radiology and the radiologist to interpret the studies. And we have a full lab that we can get near instant results for almost any lab test we want. So that's different from a lot of other urgent cares. We have full access to all of our medical records, just like you were seeing at the medical center. A lot of times the wait is shorter to be seen, and that's always a big problem in the emergency department, of long waits because things are so crowded in the emergency department. The other thing is usually the turnaround time. The time from when you get in to when you get out is shorter because we've built in kind of an efficient system to get seen. And also a lot of times, and this is increasingly a concern for people, the copay for your insurance is a lot less. A lot of time for the emergency department, the copay can be up to several $100s, and in urgent care, it's usually the same as a specialist visit, so sometimes $20 or $40, which is a big difference. Patients love it. They don't need an appointment. They come in and get seen quickly. They're evaluated by a board-certified emergency doctor. They get all the studies they need. They get all the lab tests they need. We are able to communicate with their doctors seamlessly if they're a BID patient, and they get home quickly, and it's great.